Hello, my name is Dr. Saima Qayum.
We are from Abu Dhabi and we are here to take a brief interview from Dr.Swapnil Mane, who is a founder and the president of Saidham Foundation Shirdi. So, sir, I would like to ask a few questions. So, to begin with, as we all know, cancer is not only a medical concern, it is also a social and family crisis. So, your long experience with Saidham Foundation, what did you see that the mistakes the patients do before they are diagnosed with the cancer?
Yeah. Very good question, doctor. So, as you know that more than 8 million people are affected yearly all over the world. So, cancer becoming the national crisis each and every country, and so much rapidly proliferating the dreadful disease. And I should say, ma'am, as per our experience, since 15 years, our organization is working in the cancer scenario, that prevention, screening, treatment, rehabilitation, research, and a lot of things we do for the cancer patients in rural India. As you know, the 60% India's population resides in the rural area. So that is a great motivation. And for the Cancer Free India campaign, our team is working in the specifically rural India, and that is a needed part most. So I should say the early diagnosis is a crux of key situation. Every medical literature in the world has written that prevention is better than cure, but less likely, very less emphasis is given on this sector by the doctors, paramedical staff, lab technicians, and the patient itself. And one very common myth in the patient I have seen in the 15 years of practice, after post-graduating from the Mumbai Cancer Hospital and the KM Hospital Mumbai, that when there is a pain, they go to the hospital. Very common myth all over the world, the similar scenario. And that's a main thing, that making it patient more vulnerable for the cancer. And when there is a pain, there are 70% cases are diagnosed in the late stages. And when there is a trouble, complaint, or the symptoms or the pain to the patient, they are already in the late stages, ma'am. So that's why this is a common thing, that that's why the cancer is late diagnosed.
Doctor, I'd like to ask that, as you said, that early detection saves life. So, but as you mentioned, in rural India, it's very rare that people will come for early screening. How do you think we can change this mindset?
Yeah.
And do you really think that these community-based screening programs
Yeah.
can make a difference?
Yeah. In both the places, UAE and India, the rural population that is the needed most, ma'am. So this journey was started 15 years back when I was doing my post graduation in Mumbai. I have seen the plight of the patient coming from the long distance to the Mumbai, the long waiting queues, the residential issues, the already the cancer is diagnosed in the late stages, and if they get dates of the operation after the 3 months, 4 months, very difficult situation for them for the treatment. So in such a scenario, that was a great motivation when I was in Mumbai, and I started this foundation in rural area. That our 60% India's abadi or the population resides in the rural area, so there is a need to work in the rural area.
Indeed.
And I've seen there is a challenge for the people coming from the rural India to the Mumbai city, and that's why I started this small organization, that is Saidham Foundation in the Rahuri, and in rented premises, 15 bed rented premises, so that it will serve the people where there is a need. So it was started, now it's working in the 13 state and 5 countries,
I see.
and specifically. And as you said, people's mobilization was very difficult initially, but due to the trustworthiness, due to the our team is very much competent, qualified, their expertise in those sector. They will counsel in the regional languages, and they remove all the superstitions, beliefs, misbeliefs, myths, and they then will talk to the community leaders, and they started coming up for the things. And regional language, we explain them that how the cancer is so simple to diagnose, so
Yes.
simple to cure, how the awareness is created, how to take a more medical education about the cancer, and these are things are taught in the community level, and that's why patients are coming up for the screening, and our all project becomes successful. There are about more than 20 projects we run. That is a
Amazing.
community-based CSR initiative under the CSR support of various corporates of the country
Alright.
in India.
That's
Yeah.
great. That's great, Doctor.
And
Very
similar
impressive.
model can be implemented in UAE. Near what I should say, the 10 lakh population, but we should have a one van.
Yes.
That van will dedicatedly do the cancer screening, 200 patients per day, and a lot of good cancer cases will detect in the early stages, and that will be the life saving for the patient.
No, we all aim towards that
True,
because, as
very
you
true.
said, Prevention is definitely better
than
than
cure, ma'am. Yeah.
So, sir, aside of the screening process, once the cancer is diagnosed, it is, as you can see with your patients, that the family is affected. That it's not only physical but it's emotional and financially overwhelming for the family and the patient. So, charitable organization like as yours, Saidham Foundation, what role do they play in actually helping the patient and their family throughout the journey of the cancer?
Yeah.
Yes.
Very true, ma'am. Near about doctor, near about 15 years, near about 16,000 patients has been treated, and 90% of the cancer cases. And we are 100% doing the implementation of the Prime Minister Jan Arogya Yojana. That is very, very ambitious scheme by the government of India. And patient has to produce only the Aadhaar card, ration card, or the Ayushman card, Ayushman Bharat card. Yeah, and that is the unique citizen ID created by the under the Prime Minister Jan Arogya Yojana. Very, very good scheme. And whatever the meager amount reimbursed by the government of India for that patient, and that is sufficient for the charity like us, charitable hospitals like us to run. And that was the main motto. And mission was the same thing, that to provide the treatment, whatever the quality care treatment we get it in the Alain, Abu Dhabi, Dubai, all the Emirates of the UAE. So same treatment should be imparted at the rural level, and that was our motto behind that. And a lot of people getting help. And as you said previously, before the this government scheme or the charitable hospitals, the patients psychologically, financially,
Yes.
and the whole family get disturbed, whole family get ruined, and very difficult to cope up our family. I have seen the I belong to a very small village in the Ahmednagar district of the Maharashtra, near to Ravli, 25 kilometers from the Ravli, named Songaon. It's outskirt of the Maharashtra, very small village. I have seen the plight of patient, that they have to sell their farmlands, they have to sell the lot of precious thing, gold, to cover the cancer expenses. So that was the scenario that time. Now with the advent of this foundation, with the Saidham Hospital, lakhs of people getting benefited, more than 10 lakhs, including community project and hospital, more than 10 lakhs people has been screened, and more than 16,000 patients has got a relief. That this is not a treatment we have done. We are able to save the life of 16,000 patients. So this was scenario, and such a same model. This is called the Saidham model of cancer care, that has been a purely successful model in the country and abroad. And a lot of places the corporates are uh, corporates are requesting us, demanding us to start. Like in Nepal, we started in the Kathmandu, Pokhara, Nepalganj. Like in Uganda, we started in the Kampala city, capital of the Uganda. In Mozambique, this Portuguese speaking country, where we started in the Maputo city. In Ethiopia, we started in the Mekele. There we started the Sinado, the Cancer Free Africa Mission.
Oh, wow.
So a lot of this model became very successful, and this is the model, I should say, after my 15 years I've spent in this rural sector, that this model, if we implement each and every remote part of the world, this will become successful. And forthcoming 5 years, we are able to reduce the cancer burden half the way. So this is the thing, and that's why our team is continuously striving for the cancer-free India mission since 15 years. Yeah.
No, so thanks for that, Doctor.
Thanks.
Now, I wanted to ask you, from UAE to India, you see a lot of changes in the lifestyle.
Yeah.
You'll see from the diet to stress, physical activity, smoking, so many factors. From your immense experience, what do you think, how do these factors actually, if we modify these factors, can reduce the cancer risks?
True. The main factor, the causative factors for the cancer in UAE and in India, the 90% factors are same. Like the addictions, aging population, then the lifestyle and environmental factors. It's forming the crux of situation. Also the obesity, lack of exercises, and sedentary lifestyle. And this younger generation is taking so much stresses for the career, for the different things, very small things. They are taking so much stresses, and that is a worrisome issue. And a lot of people are they are physically inactive and engaged in the screen addictions. Like a lot of things, rational use of screens are not there, like mobile, like this computer, laptops, lot of things. So these are the factors, and has to be curbed within time, I should say. And but UAE, I should say, in Islamic countries, the Holy Quran, the alcohol is forbidden. That is a best factor, I should say. Very, very good thing, I should say. Due to that, the 90% people don't have the addictions, and that one of the cancer does, like the stomach cancer, intestinal cancer, liver cancers are directly linked with the pancreatic cancer. That is linked with the unrestricted abuse of the alcohol. That is the most factor, I should say. But these are factors we should improve, and this message we should pass to this population about this factor, and plus the screening is needed. And in Saidham model of the cancer care, we have started, doctor, the screening,
Yes.
awareness, treatment, rehabilitation, research. These all the making it a very holistic model for the cancer care. Research we see in the Western countries very important. Even in the small population, they do the research.
Yes.
But research also the integral factor that has to be implemented along with the treatment. So we got a R&D center in Shirdi. We got the 6 to 7 scientists day and night. They are partially and fully employed for and we are recognized by the government of India for the zero recognition, scientific and industrial research organization, and they regularly fund us for the research. And more than 28 patents we have in Gynaec endoscopy, cancer, and many things. And recently, there good news for the cancer-free India companies that our 2 devices, the breast cancer device and cervical cancer device, the cost-effective cancer devices we made for the rural population, that easier to do. Family can detect its own cancer.
Great.
Based on the photon principle our scientist has done. We got a patent for that, and the ICMR recognition, and that is in the animal trial phase, and recently sooner it will be published for the common public, and that will be
Sure,
win-win
all the best.
situation.
You're doing
Yeah,
amazing work.
Amazing.
Thank you so much for the
So to close up with,
Yeah.
one message for all the Indians living in India, living in UAE, living any part of the world, a message that you could give that they could potentially save a life, what could that be?
I should say for all the Indians, as far as this cancer is considered, they should implement all those lifestyle factors, avoiding the high carb diet, avoiding the junk food items, avoiding the bad fats, and increasing the more protein diet is good for everyone.
Yes.
Any single citizen, any country, not only
Yes,
Indians.
Yes.
True.
And Indians are always great, I should say. A lot of healthcare sectors are supported by the Indians forces, they always make the India proud, and that is very proud thing.
You are
And,
one. You are one among them.
Thank you so much, ma'am.
Yes, yes.
Yeah, yes. It's a little bit contribution for our national cause and for countrymen's, ma'am. Yeah.
Yes.
And that could not be completed without the Baba's blessing. That is my beliefs in childhood, that Baba is doing everything, the good things for all. So these are the things, and I should say we are having the more focus of the child education also, the school awareness also. Our team, the vans, mobile vans, daily one school, 200 people screening, awareness in the school. We have got a concept that if a school children get aware, so throughout the lifetime he will be mature enough, he will be aware about the cancer, the good lifestyle, avoiding the addictions, and he will motivate more people. At least 1,000 people he will motivate. He will make an awareness till he become the mature or the 18 or the major, 18 to 20 years of age. So this is a thing, so very important. And another things we can do, we implement in the community, making the neighborhood, making the relatives, making the community awareness for the cancer daily.
Yes.
One should have a target, daily 10 people I should tell about the cancer, the good dietary habits and good things. That is also the mission we started in the periphery, in the CSR initiative by the Saidham Foundation. We started, and that become a very successful formula in the community.
Again, asking about motivation, do you ever feel that you're not able to give enough time to your family, your personal life, and that sometimes you feel that why you need to do so much, like we think sometimes,
Yeah. So everyone's the perception is different. My perception, since childhood, when one of the incidents happened in my childhood, when I was in 5th standard, then one of the neighbor, Godse Kaka, he died due to lung cancer.
Okay.
And he, that time, he was very unaffordable for the treatment. So one of hospital told him that 50,000 was the expenses. And that was a great motivation for me. That was, since childhood, I have a motivation. And I should say, as compared to family, the national cause is very important.
Oh, that's
Serving our countrymen's poor and needy, downtrodden population is very important. I should say the family is also important, but it has a little bit lesser role as compared to the national cause, and that is my vision, my view about this thing. Yeah.
We knew that, but we thought of asking this because
We
can see this in your vision and in your work. And Saidham is really doing an amazing work at that too, at the grassroots levels. And
Sure. And Saidham is Doctor very very holy name.
Yes.
Saidham is a temple of the god. Temple is very holy place in Hindu literature, and the same atmosphere. Our doctor, our patient, should that they are coming to the holy place and they will be getting relieved of their complaints, the disease, and that is where this concept was started in what I already I told in 2011 that Saidham name is as science people may not believe, but my belief is in my spiritual leader, Lord Sai or the Sai Baba is there in childhood, because Baba has fulfilled all my wishes. Every Thursday from from since my childhood, I used to come to the Baba for the prayer, and every time I ask the Baba that make me the doctor of the poor and needy, and that was a request to Baba, and Baba has done everything positive, everything. They are blessed with things. Then from my first standard government school to the Tata Cancer Hospital, KM Hospital, Mumbai, not a single penny is required, and it is due to the Baba's blessing only. That is my belief in childhood. And another instance I said that I once the 3 years back I went to the Baba's Gurusthan. It's a holy place after the temple, Gurusthan, and I expressed the wish, Baba, please create such a big hospital in the country that will serve our pan-India population, so that no any Indian should be deprived about the good cancer care, good cancer treatment. And I told to Baba, I say,
You
I pray
asked.
always. I ask Baba to create it. And that's Baba's miracle, very difficult to understand for the educated people. After 15 days, I got a phone call from Shirdi airport that my name is Santosh Sonan and I would like to donate this 22 acres of land for the Baba's cause.
Oh my God, that's
And now
amazing.
within 1.5 months, we are starting the construction for the 100-bed cancer hospital. And that is whatever the donor, that grandfather used to sit with Baba in that pious land.
your vision is coming to
Yeah,
life.
we did coming
Yes.
true. And this has also miracle, I should say. That is
No,
for
you're definitely blessed by some divine power.
And this hospital will serve pan-India basis, and Shirdi has a national international connect. So any remote part of the country, in my vision, the person should come to the Shirdi and avail this facility, the food facility, the hostel facility, residential facility, treatment, everything under the various government scheme we like to implement in that hospital. And that is our dream project by our foundation.
It's an amazing vision. Doctor, one question that I would also like to ask is regarding the training program. So as we see all around that we see surgeons always trying to keep their skills to themselves. You have started this initiative and you have been teaching a lot of students, as we can see that there have been so many Saidham students who have went and learned from you your skills, your expertise. So why did you think of doing this? Why you started this?
During my post-graduation, I have seen that certain clinical skills every gynecologist and the Gynaec Onco surgeon should know. And no one was paying attention for that. Certain bosses, what happens, they kept this knowledge limited to them.
Yes.
They don't want to percolate this knowledge to the future generation.
True.
And the very age-old protocols were taught in the medical schools. There is another little bit the disadvantage of the Indian medical system I observed during my post-graduation. And after that, I have started reading the books, seeing the workshops, and started this in this same hospital, the trial and error for the patients, and we concluded our own protocols. And
Self-learned.
Self-learned protocols, that after thousands of cases we concluded certain step, that this step if you do in such a way that will be very comfortable, complication free technique for the treatment for the cancer and the gynec disorders, and our future generation should not suffer. We suffered, but our future generation should not suffer, and ultimately the citizens going to get benefit. So under the Maharashtra University of Health Sciences, we started these courses for the F-Mass and D-Mass courses, and there were 1500 people got benefited, and everyone learned this Saidham peculiar model, the Saidham patented techniques, and they're enjoying their laparoscopic career, and they're serving the citizens in the very remote part of the country in their homelands. So that's why I have started this medical training center to percolate this knowledge, patented knowledge to the fellow gynecologists and gynec onco surgeons, so that they will learn, and ultimately the citizens will have a most cost-effective technique for their treatment.
That's really
Yes.
noble of you.
Thank you so much. Yeah.
We want to have more and more, insight about your very amazing and very impressive journey, Doctor. But we have time constraint, so we'd like to thank you. Thanks a lot for your time, and Thanks for just walking us through the
Enlightening
journey.
us through this
Thank you
journey.
for you really made us to walk through the journey of
Thank you
Saidham
so much,
Foundation.
And it's a commendable job that you've been
Thank you,
doing
ma'am.
here. It's
We wish you
really
all the best,
very-
and we want to take these important points, and we would, if we can implement it anywhere, including UAE. Thank you
so
for
much.
your time.
Thank you.
Thanks,
Thank you
Doctor.
so
much.
much. Thank you. It was a great honor to actually meet Dr. Swapnil Mane and know about his admirable journey he had throughout his life. He had done commendable job helping the rural India, all his plans and aims to give best treatment to all the people who are deprived of this. So this is what I would like to wish him a very best of luck and wish all his visions come true, and everyone out there, whoever can contribute for his vision to come true, I would like you to participate and contribute as much as you can.